Which additive is found in the lavender top tube? A. Sodium citrate. B. EDTA. C. Lithium heparin. D. Sodium fluoride. Answer B. Lavender tubes contain EDTA, which binds calcium to prevent clotting. They are commonly used for hematology tests such as CBC, ESR, and blood smears. What is the main function of sodium citrate in light blue tubes? A. Preserves glucose. B. Stabilizes hemoglobin. C. Separates serum from clot. D. Prevents coagulation by binding calcium. Answer D. Sodium citrate binds calcium to prevent clotting, making light blue tubes essential for coagulation studies like PT and APTT. Which additive is in the green top tube? A. Potassium oxalate. B. Lithium heparin. C. Sodium fluoride. D. Thrombin. Answer B. Green tubes contain heparin, sodium, lithium, or ammonium, which inhibits thrombin and clotting factors, useful for plasma chemistry tests. What additive is present in a gray top tube? A. Sodium fluoride and potassium oxalate. B. EDTA only. C. Thrombin. D. Gel separator. Answer A. Gray tubes contain sodium fluoride, glycolysis inhibitor, and potassium oxalate, anticoagulant. They are used for glucose and alcohol testing. Which additive is found in yellow SPS tubes? A. ACD. B. SPS. C. Sodium heparin. D. EDTA. Answer B. Yellow tubes with SPS, sodium polyenethyl sulfonate, are used for blood cultures as they preserve microorganisms by preventing phagocytosis. Which additive is found in yellow ACD tubes? A. Acid citrate dextrose. B. Sodium fluoride. C. Lithium heparin. D. EDTA. Answer A. Yellow ACD tubes contain acid citrate dextrose, used for DNA testing and HLA typing because it preserves nucleated cells. Which tube contains thrombin to accelerate clotting? A. Red. B. Orange. C. Lavender. D. Gray. Answer B. Orange rapid serum tubes contain thrombin, which speeds up clotting, providing quicker serum separation for stat chemistry tests. Which additive is in black top tubes used for ESR? A. Sodium citrate. B. EDTA. C. Lithium heparin. D. Potassium oxalate. Answer A. Black tubes contain sodium citrate at a specific ratio used for erythrocyte sedimentation rate (ESR) tests. Which additive is used in royal blue tubes for trace element testing? A. EDTA or Clot activator. B. Sodium citrate. C. Sodium fluoride. D. Lithium heparin only. Answer A. Royal blue tubes may contain EDTA or Clot activators and are used for trace metal, toxicology, and nutritional studies due to contamination-free materials. What additive is in a pink top tube? A. Sodium citrate. B. EDTA. C. Sodium fluoride. D. Thrombin. Answer B. Pink tubes contain EDTA, similar to lavender, but are specifically used for blood bank testing such as type and cross-match. Which additive is in light green tubes? A. Lithium heparin and gel separator. B. EDTA. C. Sodium citrate. D. Thrombin. Answer A. Light green tubes contain lithium heparin and a gel separator, useful for plasma chemistry tests such as electrolytes. Which additive prevents glycolysis in glucose testing? A. EDTA. B. Sodium citrate. C. Sodium fluoride. D. Lithium heparin. Answer: C. Sodium fluoride inhibits glycolysis, preventing glucose breakdown in blood samples, making it vital for accurate glucose and alcohol testing. Which additive is present in dark blue tubes labeled for toxicology? A. EDTA. B. Lithium heparin. C. Clot activator. D. All of the above. Answer: D. Dark or royal blue tubes may contain EDTA, lithium heparin, or clot activators depending on the test type. They are designed for trace element analysis. What additive is found in red top tubes without gel? A. Sodium citrate. B. No additive or clot activator. C. EDTA. D. Sodium fluoride. Answer: B. Plain red tubes may contain no additive or a clot activator. They are used for serum collection in chemistry and serology tests. Which additive is in tan top tubes for lead testing? A. EDTA. B. Sodium citrate. C. Thrombin. D. Lithium heparin. Answer: A. Tan tubes contain EDTA and are specifically certified lead-free for accurate lead level testing. Which tube contains potassium oxalate as the anticoagulant? A. Gray. B. Green. C. Lavender. D. Orange. Answer: A. Gray tubes combine potassium oxalate, anticoagulant, with sodium fluoride, glycolysis inhibitor, useful for glucose and alcohol levels. Which additive is present in pearl top tubes used for viral loads? A. Sodium citrate. B. Polymer gel and EDTA. C. Sodium fluoride. D. Thrombin. Answer: B. Pearl tubes contain polymer gel and EDTA and are used for molecular diagnostic tests such as HIV viral load. What additive is used in coagulation studies to preserve label factors? A. Sodium citrate. B. Lithium heparin. C. EDTA. D. Sodium fluoride. Answer: A. Sodium citrate in light blue tubes preserves clotting factors, making it the standard additive for coagulation testing. Which additive is in tubes used for HLA typing and paternity testing? A. EDTA. B. ACD. C. Heparin. D. Sodium fluoride. Answer: B. ACD tubes are specifically used for genetic and immunohematology testing such as HLA typing. What additive is present in tubes used for therapeutic drug monitoring when serum is required? A. Thrombin in orange tube. B. Sodium fluoride in gray tube. C. Lithium heparin in green tube. D. EDTA in lavender tube. Answer: A. Orange tubes with thrombin accelerate serum formation, suitable for stat therapeutic drug monitoring. Which additive is present in gold top tubes? A. Clot activator and gel separator. B. EDTA. C. Sodium citrate. D. Lithium heparin. Answer: A. Gold tubes, SSTs, contain clot activator and gel separator to yield serum for chemistry and serology tests. Which additive is used for plasma ammonia testing? A. Sodium citrate. B. Sodium fluoride. C. EDTA. D. Lithium heparin. Answer: C. EDTA tubes are commonly used for ammonia levels, which require immediate chilling and rapid processing. Which tube should be used for lactate testing? A. Gray. B. Lavender. C. Green. D. Gold. Answer A. Gray tubes with sodium fluoride and potassium oxalate prevent glycolysis, making them suitable for lactate levels. Which tube is most appropriate for troponin levels in suspected heart attack? A. Green lithium heparin. B. Gray sodium fluoride. C. Lavender EDTA. D. Orange thrombin. Answer A. Green tubes with lithium heparin are commonly used for plasma chemistry tests including cardiac markers like troponin. Which tube additive prevents platelet clumping? A. EDTA. B. Sodium fluoride. C. Sodium citrate. D. Thrombin. Answer A. EDTA prevents calcium-dependent platelet aggregation, preserving cell morphology and preventing clumping. Which tube is commonly used for electrolyte testing? A. Black with sodium citrate. B. Gray with sodium fluoride. C. Lavender with EDTA. D. Green with lithium heparin. Answer D. Green tubes with lithium heparin are plasma separator tubes, ideal for electrolytes like sodium, potassium, chloride. Which additive is used in tubes for glucose tolerance testing, GTT? A. Sodium fluoride and potassium oxalate. B. EDTA only. C. Sodium citrate. D. Thrombin. Answer A. Gray tubes with sodium fluoride and potassium oxalate stabilize glucose levels for GTT procedures. Which additive is found in tubes used for C-reactive protein, CRP, testing? A. EDTA. B. Sodium fluoride. C. Lithium heparin. D. Sodium citrate. Answer C. Green tubes with lithium heparin are often used for plasma chemistry tests including CRP. Which tube contains an additive that acts by inhibiting thrombin and clotting factors? A. Green. B. Gray. C. Lavender. D. Pink. Answer A. Heparin in green tubes inhibits thrombin and clotting factors, preventing coagulation and allowing plasma collection. Which additive is used in tubes for HbA1c testing? A. EDTA. B. Sodium fluoride. C. Lithium heparin. D. Sodium citrate. Answer A. HbA1c testing requires EDTA whole blood, making lavender tubes the standard choice. A physician orders a coagulation study and a serum chemistry test for the same patient. Which sequence of tubes ensures proper results without additive carryover? A. Lavender first, then red top. B. Light blue first, then red top. C. Red top first, then light blue. D. Gray top first, then red top. Answer C. The red top, serum, no additive, should be collected before the light blue tube, sodium citrate, to avoid contamination of clot activators or anticoagulants that could alter coagulation test results. Additive carryover from citrate can falsely prolong clotting times, making strict adherence to the order of draw critical. A gray top tube is accidentally collected before a serum separator tube. What is the greatest risk to the accuracy of results? A. Hemolyzed potassium. B. Artificial hypoglycemia. C. Chelation of calcium and alteration of electrolytes. D. Glycolysis inhibition leading to high glucose. Answer C. The gray top tube contains potassium oxalate and sodium fluoride. If drawn before serum, oxalate may chelate calcium, altering electrolyte panels and affecting other chemistry results. Carryover from fluoride can also distort enzymatic assays. This error compromises diagnostic reliability. Which additive specifically stabilizes coagulation factors V and 8 for accurate analysis? A. Heparin. B. Sodium citrate. C. EDTA. D. Sodium fluoride. Answer B. Sodium citrate preserves coagulation factors V and 8, which are labile and quickly degrade. By binding calcium in a reversible way, it allows accurate PT and APTT testing. Using EDTA or heparin would irreversibly bind calcium or alter pathways, making them unsuitable for coagulation studies. A light green PST tube and a dark green lithium heparin tube are both collected. Which difference in additives primarily affects the post-centrifugation specimen? A. Separator gel formation. B. Presence of anticoagulant. C. Prevention of glycolysis. D. Promotion of clot formation. Answer A. Both contain lithium heparin anticoagulant, but only the light green plasma separator tube has a gel barrier. This gel creates a physical separation between plasma and cells during centrifugation, preventing cellular metabolism from interfering with plasma analysis. Which blood collection tube would most likely interfere with PCR testing for genetic analysis? A. EDTA, lavender. B. Citrate, light blue. C. Heparin, green. D. Fluoride oxalate, gray. Answer C. Heparin strongly inhibits DNA polymerase, making it unsuitable for PCR testing. EDTA is preferred because it prevents clotting without interfering with amplification. Choosing the wrong tube could invalidate costly molecular diagnostic tests. Why is EDTA considered superior to citrate for hematology cell morphology studies? A. Citrate causes hemolysis faster. B. Citrate dilutes the sample, altering indices. C. EDTA enhances platelet clumping. D. Citrate interferes with plasma separation. Answer B. Sodium citrate dilutes the blood sample in a 1:9 ratio, which alters cell counts and indices. EDTA preserves cellular morphology without significant dilution, making it the anticoagulant of choice for CBCs and peripheral smear evaluations. A sample for lactic acid testing is delayed in processing. Which additive ensures accurate results by halting glycolysis immediately? A. Sodium citrate. B. Potassium EDTA. C. Sodium fluoride. D. Lithium heparin. Answer C. Sodium fluoride is a glycolysis inhibitor that prevents continued breakdown of glucose and production of lactate by cells. Without fluoride, lactic acid levels may falsely increase due to ongoing metabolic activity during transport or storage. A phlebotomist mistakenly collects an ammonia test in a red top tube. Why is this a significant error? A. Serum is unstable for ammonia analysis. B. Red tops contain fluoride, which interferes with results. C. Ammonia requires heparinized plasma kept on ice. D. Ammonia is only stable in EDTA whole blood. Answer C. Ammonia testing requires rapid processing of heparinized plasma kept chilled to minimize metabolic changes. Collecting in a red top delays separation, causing falsely elevated values that may mislead diagnosis of liver dysfunction. Which mechanism makes citrate anticoagulation reversible, unlike EDTA? A. Precipitation of potassium. B. Calcium chelation in equilibrium. C. pH stabilization. D. Formation of insoluble salts. Answer B. Citrate binds calcium in a reversible equilibrium, meaning calcium can be restored by adding excess calcium in the laboratory during coagulation testing. In contrast, EDTA binds calcium irreversibly, making it unsuitable for coagulation assays. Why is the yellow top ACD tube specifically used for HLA typing and DNA studies? A. It contains a PCR enhancer. B. Acid citrate dextrose preserves leukocytes. C. It prevents RNA degradation. D. ACD stabilizes clotting factors. Answer B. ACD, acid citrate dextrose, preserves white blood cell integrity, ensuring that viable leukocytes are available for HLA typing and DNA extraction. It prevents cellular breakdown, which is crucial for genetic testing accuracy.